Hello and welcome to Rad Chat, the multi-award-winning therapeutic radiographer-led oncology podcast. My name's Jo McMahon and I'm joined by fellow host Angelika Anderson.
Hi everyone.
So here we are at UKIO, the final podcast episode. Woo-woo! I can't actually remember how many we've done. I think it's probably almost 30 episodes over the course of the 3 days. It's been very busy. But we have a very special guest to join us last of all. Would you like to introduce yourself?
Hello everyone, my name's Dr. Emma Hyde. I'm an Associate Professor in Diagnostic Imaging at the University of Derby.
So Emma, why are you here?
Why am I here? Well, this year I'm here as Vice President of UKIO. So I've been leading the education and workforce strand, which has a huge number of sessions within the programme. So it's been really busy this year, supporting the team that have been leading on each of the different sessions. We've had more sessions than ever before, so the number of sessions within the education and workforce work stream increased by half again from last year.
Wow.
So we've had a huge number of sessions, huge number of speakers to coordinate. Really, really exciting speakers. It's been an absolute pleasure to be looking after it.
And you have quite an exciting prospect for next year, don't you? Because you actually take over as president.
That's right. So shortly after the Congress this year, I step into the role of being president for 2024 and 2025. So slightly daunted by that prospect at the moment. The reality is starting to hit of what's going to be involved, but really, really excited about the opportunity and really proud that as a radiographer, I'm able to be president. We know that there's not been as many radiographers historically as radiologists, so I feel like this is one for the profession. I'm really proud of that.
Can I ask, why is it daunting?
Why is it daunting? I guess it's just I want it to be the best it can possibly be. I care so much about the Congress. I've been coming here since I was a student radiographer in the 1990s. It wasn't called UKIO back then, I can't remember the acronym, but it was the same format, the technical exhibition and the scientific programme, and I just want it to be the best it can possibly be, to keep people coming into this rich multidisciplinary environment where we're learning with, from and about each other. It's so important as imaging and oncology professionals to understand each other's roles and learn together.
So Emma, you've always been kind of one of those people within the profession that people look up to, the work that you're involved in. Outside of UKIO Congress, what things are you involved in at the moment?
So I'm continuing my role as Clinical Director of the Personalised Care Institute. I've now been in that role 18 months and I've got at least another 9 months there. After April 2024, we're not sure what the funding model is going to look like, so I hope that I will be able to stay, fingers crossed. But that's been a fantastic role. Again, as a radiographer, to be in that role, you know, I'm working a lot with primary care, so it's a really different environment for me to work in. You know, as a radiographer, I'm used to be in an acute secondary care environment, so getting in touch with all these different colleagues in a primary care setting, but we've all got the shared interest of making things better for people receiving care, whatever that care is, has just been fabulous. So that work continues. Obviously the presidency role will kick in big style. I have my associate editor role with the Journal of Medical Imaging and Radiation Sciences, JMIRS, that will continue. And lots and lots of other things, you know, continuing to do my peer reviewing for radiography, continuing all the other things that I've been doing for a few years now.
Quite busy then.
Quite busy, yeah, quite busy. But I'm lucky in my role now as an associate professor. I do have dedicated time for these activities, so that's
makes
so great. It makes a big difference. Yeah, to actually, you know, be encouraged, supported, to have the time to do that makes a huge difference.
So obviously the things that you're involved in and the opportunities you've had, people may look at you and inspire to also replicate maybe a career pathway, portfolio, career. What advice would you give to anyone kind of looking up to you now, thinking that's something I'd like to do in the future?
So I think the important thing is to have a growth mindset, to not be limited by what you think you can or cannot do, to actually be able to be a little bit uncomfortable. I'm not saying I'm not uncomfortable, but a little bit uncomfortable of being out of that happy zone where you currently live and push yourself a little bit. That way you will grow. So say yes to the opportunities, don't be scared, take them on, read up around them clearly, make sure that you're prepared to do them, but step into that zone of discomfort so that you can grow as a result from it. And I've found in my career, by just doing that, more things have happened. So the more I push myself, the more things I've been offered, and the more my growth has been. So I'm not saying that my career trajectory is perfect by any stretch of the imagination, but hopefully that little bit of advice may help others.
How important is it for radiographers to advocate for themselves?
To
advocate for themselves.
Oh, it's really important. I think we constantly undersell ourselves as a profession. I think there's still an element of we're quite subservient to the medical colleagues that we work with sometimes, not always, but sometimes. And I think we need to stand on our own 2 feet. We are confident, capable professionals. We're the experts in our field, and we're the experts in patient care because we're the ones that have that close contact with them. Medical colleagues a little bit removed from. We need to own that space. That's where we've got our moment to shine.
So Emma, what do you want for UKIO in the future? What plans have you got in the making?
I don't think anybody would be surprised about my plans. Person-centred care is going to have a huge focus. I'm really, really keen to push that. We increased the number of sessions and the focus on that a lot this year. We brought the patient voice in more than ever before, and I'd like to continue that next year. I have plans that we will get patients included accreditation, which will really recognise the voice of patients throughout the Congress, not just as speakers, but actually being involved in the design and development of the programme and actually being part of our audience and contributing to the sessions that way as well. I also really want to increase the focus on sustainability. The NHS is the 5th largest contributor to the carbon footprint in the UK, so I think there's still lots we can do within imaging and oncology to recognise our impact and try and reduce it. So I'd like to use the Congress to get some of those messages across, get people thinking about what they can do in their practice.
All sounds amazing and exciting at the prospect of what it's going to look like in 2040.
Got an important question for this year, UKIO. What was the best coffee that you had?
The best coffee? Well,
I'm
going to have to drop a name here, but it was on the Fuji stand.
Yeah, it was a really good artwork on the top.
It was amazing. And those beautiful Japanese Kit Kats as well. My goodness.
Oh, I've not had one of those. Oh, I might need to go and visit.
So I've been to Japan, and you can go in the shop and there'll just be rows and rows of different flavours of Kit Kat. They're like the best in the world.
They are delicious, aren't they?
Okay, so next year, coffee, Fuji, there you go.
Yeah, they'll have to get a lot of
Everyone else
ready.
needs to up their game.
Oh, well, thank you so much. It's always a pleasure to have you on the podcast, and we wish you every success for the presidency.
Thank you so much, and well done to you both for doing such an amazing job with this podcast. It's just phenomenal.
Oh, thank you so much. Oh.